Hermann Reichenspurner, welcome.
Thank you.
As you know, the ISHLT has begun what we call the History Project, which is to collect thoughts and reminiscences from individuals who have had a major role in the field and in the society. And we're very interested today in capturing some thoughts from one of the winners, one of the first winners of the Caves Award. And so I'm very happy that you've agreed to be with us today.
Yeah, thank you very much for inviting me. It's a pleasure for me to be here.
Before you won the Caves Award in 1984, you were, as a medical student in 1982, I believe, working with Bruno Reichert.
Correct. He was the supervisor of my MD thesis in Munich, and we were working on developing a blood test for the detection of acute rejection called cytoimmunologic monitoring, and it was under his supervision.
And that took you then to, I understand, to Stanford for an elective there.
Yeah, that's right. We went there, it was with another student colleague of mine. We went in the summer of '82. We went to Stanford and worked with Stuart Jamieson mainly, who was in charge of the transplant program then, and also of the lab. And we had a great time there. It was one of the best times I had.
How long were you there during that elective?
It was 4 months.
4 months. At a time when heart transplantation was expanding tremendously, primarily at Stanford, with amazing work being done there. Tell us about your work in the lab.
Well, we worked in the lab, first starting with a project on heart transplantation in rodents, so we learned how to do heterotopic heart transplantation in rats. But then mainly together with Stuart, we worked on long-term preservation of organs for combined heart-lung transplantation, because until then it was actually the case that the whole donor was transferred to the implantation hospital, and so the research we did led to the fact that later on you could just transport the organ blocks.
So remote retrieval was...
Yes, correct.
That's right, you would still transfer the whole...
And pulmonary preservation was an unknown entity at that time, because they only started with heart-lung transplantation with Bruce Wright's 2 years earlier. And then Stuart took over in '84 when Bruce went to Johns Hopkins, and that was his field of research.
So 1982 in Stanford, what was it like then? So you were just a young medical student, and had you thought already about, I mean, clearly you were interested in transplantation at that point already, and you end up in one of the labs with the most amazing history of the science that is leading to a new clinical therapy in transplantation. What was it like?
I think the two things which impressed me most, next to the professionalism of the work which was done there, was the atmosphere, because I come from a very conservative medical school in Munich, where there's the big professor and the small little student. And I remember when we arrived, it was sometime in the afternoon, and we looked for Dr. Chamboy's office, and he received us immediately when he saw us. And he said, "Oh, you guys must be the two students from Munich. How are you guys? And do you have a place to stay already?" And I said, "No, we're actually going into Palo Alto. We have some addresses. You can stay in my office as long as you didn't find something." So it's typical, Of course, we didn't do that, but I mean, nobody would say that it's in Germany to a medical student that we could stay in the office overnight of the chief of the program. Typical Chamboy. So that was typical for the atmosphere there. But of course, which was also impressive was really the work which was done there, both clinically with really experienced people such as Ed Stinson and Sharon Hunt. And on the other hand, you had younger people like Stuart Jamieson, who was very energetic, wanted to drive the heart-lung program forward. And well, we were there, and we didn't really need a place to stay, because we went there at 6 o'clock in the morning and we stayed there till 9, 10 every evening. It was so fascinating.
What did you do exactly?
Well, basically we spent some time in a clinical service, I think 4 weeks or 6 weeks. And then we thought we work in the lab the other time. And the lab time was then extended a little bit for unforeseen reasons.
Can you tell us a little bit about that?
Yeah, it was a funny story, because once we started in the lab, about a week later there was a big strike of the union of anybody who worked in laboratories. So the personnel which worked in the lab. And it was Grant and Jesse at the time, two great guys, and they ran the lab, and they did everything. Yeah. But there was a strike, and Stuart wanted to continue the experiments. There was a deadline coming up and whatever. So we ran the lab. We were the technicians in the lab for at least 4 weeks, I would say.
And what did your duties involve?
Well, the duties were actually, one of us was the sort of anesthetist we did heart lung transplants in primates at that time, cynomolgus monkeys, and one of us was the scrub nurse, and it turned out to be that I was mostly the scrub nurse actually, but those were the more elite duties. There were others like cleaning the floor and washing the instruments and whatever, and I remember one day Stuart Jameson came into the lab and he said, it stinks here. What's the issue? And then it turned out that we did regularly clean the floor, but we forgot to change the cleaning water.
So perhaps you learned from the ground up then, I guess.
Exactly.
So you went back to Munich then, clearly inspired by what you saw as a young medical student in the hub of activity at Stanford at that time, and you went on to do work that would lead to you winning the ISHLT Caves Award in 1984. What was that work all about?
Well, basically this was a blood test which we developed in the Institute for Surgical Research with two immunologists by the name of Walter Brendel and Klaus Hammer. We developed a blood test detecting acute rejection. It was based on the fact that if you isolate lymphocytes out of peripheral blood, it's called a Ficol gradient. You might remember how we did that at that time. And you look at it under the microscope, you see an activation form of lymphocytes, which is we called activated lymphocytes and lymphoblasts. And they appeared about 2 to 3 days before a rejection occurred. So that's what we found out, and we did this analysis. And interesting enough, after the Caves Award, this test was brought back to Stanford because Margaret Billingham at that time, the pathologist there in charge, she did the test for about 5 years at Stanford then.
So that could be then thought about as a precursor of some of the immune monitoring tests that are still being used today and looked at today and continually being moved forward.
Exactly. In Munich, they used the test for over 10 years, and then obviously later on there were some more, better specification of recognition of activation of lymphocytes.
So is that when you joined the ISHLT in 1984 or so?
No, I joined a little later. It was my first meeting in 1984. I went to New York City as a student. Of course, no money, and I was lucky enough that one of the fellows from Munich did a fellowship at the Albert Einstein College in Bronx. So I stayed in the Bronx in New York and drove every day with the express bus, because at that time it was not so easy to go through the Bronx, with the express bus to the New York Hilton and back. So that was my very first ISHLT meeting.
That's a good way to start, I think, though. Yeah. Nonetheless, by winning your Caves Award, and then you joined the society later.
Yes, I joined the society a little later, immediately after I joined Bruno in Cape Town.
Yes, I was just going to go. So you joined Bruno Reichardt then in Cape Town in 1987, and stayed there some years working on a PhD. Can you describe your work there?
Bruno went to Cape Town, I think, in late 1984. And he had asked me, because I was a student, whether I wouldn't want to join him in Cape Town. And I said immediately, yes, I would love to. I did still start in Munich and worked the first over a year in Munich, but then joined him in 1987 and spent 2 years there. It was a very interesting time. You were working on xenotransplantation. That's right. There was already a project going on. The project was initiated by Chris Barnard and David Cooper in the laboratory working on xenotransplantation, and used 2 different primate species actually. And at that time there was a new immunosuppressive drug called 15-deoxyspurgolin, and that's the drug we tried in xenogenic heart and kidney transplantation. After 2 years, you came back to Munich. Yes, I stayed there 2 years, so it was both a clinical and a laboratory call for me. So clinically, it was very interesting because we did not only cardiac surgery, we did a lot of thoracic surgery because there's a lot of tuberculosis still, of course, going on there. And then, which was very nice, I was lucky enough to work 1 year at the Red Cross Children's Hospital, so dealing only with children, including transplantation. And this was a fascinating time at the Children's Hospital.
Well, that must have been the very early days of pediatric transplantation then.
Yes, very early days, very early days. And of course, at that time, it was mainly adolescents, not so much the very small babies yet. But we did a lot of research next to it, so I was able to spend some time in the laboratory and could finish that off with a PhD a few years later.
And then you went back to Munich, and then once again, a few years later, you went back to Stanford again as both doing clinical work and research work.
Yeah, correct. I went back to Munich because I had to finish my general surgery. At that time, we still had to do the education also in general surgery, so I did 2.5 years of general surgery. Then I went, by that time Bruno was back in Munich, so I joined Bruno Reichert again in Munich and finished my cardiothoracic training under his supervision. And then in 1994, I had the offer by Bruce Wright, who then had taken over from Norman Shumway, to come back to Stanford as a fellow. For this, I had first to write the American board exam, which I wasn't really looking forward because I was 10 years out of medical school. So I spoke to Stuart Jameson about it, and Stuart said, why don't you come to San Diego? You can work with me, but you can also visit a very good school here we have, which prepares you for the board exam. So I came first to San Diego, stayed 6 months here, studied for the board exam, passed the board exam, and then went to Stanford.
And you worked with Randy Morris as well as doing clinical work.
Yes. I started off working in Randy's lab mainly, and it was really a great laboratory on transplantation immunology. He was a very organized lab leader, basically, at regular meetings and stuff, and we worked on an experimental model on obliterative bronchiolitis, the chronic form of lung rejection. And so we had an animal model for that and tried different drugs and diagnosis tests and so forth. So it was a fascinating time. At the same time, I was able to look after the clinical data and did an analysis on the clinical follow-up of obliterative bronchiolitis in the Stanford lung and heart lung program. And Bruce was, of course, the supervisor then. So it was a fascinating time for me, both clinically as well as research. And then I started half a year later as a transplant fellow, which at that time was called super chief, which was a funny name, but because you were sort of the guy for everything. I mean, you were there for the transplants, but you were also in a way the third chief resident. So anytime there was an emergency and they had to open up another room, then they called the transplant fellow. So I worked with Craig Miller, I worked with all of them, all of the guys there. It was a fascinating time.
You've been in Hamburg now since 2001, and you're looking back over these couple of decades then, you've maintained an active role as a surgeon scientist, which is not always the easiest, it's not always the easiest pathway, especially for our surgical colleagues. How would you look back then, and how would you advise or counsel young surgeon scientists today about an academic pathway in which perhaps, and particularly I'd like to know what the impact of that early period and receiving the Caves Award might have meant to your career development?
Yeah, that's a very interesting question, because very often I get now confronted with young people and trying to give them that advice. I got an advice from Bruno Reichert, for which I'm very grateful, because as a young surgeon, all you want to do is you want to go to the operating room and you want to do cases and stuff. That's every young surgeon is the same way. And he told me, he said, no, you start off in research, because you will do so much surgery later on that it doesn't matter whether you start a year earlier or later, it will be fine. So that's what I did. I followed his advice and spent a lot of time at the beginning of my career in research. Until actually I had my fellowship exam, I still did research in Stanford when I was already a fellow. When I then came back to Munich and later on went as the chief in Hamburg, then of course it's a decisive step, because you cannot do the research actively yourself anymore, sitting in the laboratory and doing it. Also enjoy that. So you have to build up a group of people who works with you. And I was lucky enough that when I came back to Munich to meet Sonja Schrepfer, whom you know as well, and Tobias Deuse, her husband, who works with me as a transplant surgeon. And Sonja is a very experienced lab specialist now focusing on transplant immunology and stem cell research. And so we were able over the last years, in actually collaboration with Stanford, to build up a relatively large laboratory in Hamburg. And she's doing a great job, and I try to help and advise and stuff.
So in your role as an educator as well, and building up a team of trainees, this is something that perhaps has been facilitated by interactions through the ISHLT and the community of transplanters here?
Yes, definitely. I think ISHLT always was crucial because you know, our life works that you live a little bit with deadlines, because otherwise things that just go on and on and on. And the ISHLT deadline was always for me, I don't think I've missed a lot of meetings, maybe 2 or 3 in the last 30 years or so. But it was always for me a push. I said, okay, what can I do next year? Because I wasn't able to go if I wouldn't have at least a poster to present. So I knew there was this pressure, which was good. And also hearing other people's research here, I got new ideas and I exchanged with other scientists. We had a collaboration with Helsinki going on, with Stanford anyway, and kept on the collaboration with Cape Town. And ISHLT really is a facilitator in contacts and meeting up with other people, exchange of ideas, and that's why I really always felt at home here. And I belong to a lot of surgical societies, and or cardiac societies, and I've been on the board of a few. But it's no lie when I say this is definitely, by no means, it's definitely my most favorite society.
And what do you think, just to close, what do you think that ISHLT can best do to encourage the further development of young surgeon scientists, clinician scientists, and so on in the field, to move the field forward?
Well, I think that ISHLT already brings together different specialists. So you have this interdisciplinary approach. There is no envy between specialties, never has been. Not what you see in cardiology, typical cardiology, cardiac surgery meetings. It's always about PCI or cabbage, this debate, You don't have that in ISHLT. Our goal is to help patients with end-stage heart and lung failure. And we work together. It may lead to an assist device, may lead to a transplant. Later on, it's a rejection, it's an infection, you need the ID people. So it's this collaborative effort is reflected in no other society, which I know at least, like ISHLT. In addition to this interdisciplinary approach, what the ISHLT does for many years now already, that it really encourages young people, young scientists, to sort of help them find their way. We have a junior faculty council. We have mentors which meet with the junior faculty regularly. They are on the board. There are a lot of training issues going on right now. So I think that's also, ISHLT is very good as an educator.
Wonderful. Thank you very much for your thoughts and insights.
Well, thank you very much for inviting me. It's a pleasure to have been here.